We chat to SANCA social worker and representative Megan Smith about the increasing abuse of drugs amongst the youth during the COVID-19 pandemic. Welcome to Afternoon Express, Megan.
Thank you for having us, Felisa.
Now, Megan, tell us a bit more about Drug Prevention Awareness Week that you had last week and the programs that you offer.
Prior to COVID, what we did was we went to schools, clinics, churches, inpatient rehabilitation centers. Obviously, this year is different because we're facing the pandemic. So what we are doing virtual awareness talks where we go either on radios or we're still trying to negotiate entry with schools to have us come, at least one of us to come and do awareness talks. SANCA Awareness Week aims to educate not only the youth, families, schools, communities on what the effect is of substance abuse and a dependent of substances.
Now, Megan, what are the leading causes or risk factors that contribute to drug abuse amongst the youth?
Felisa, there are a wide range of risk factors that contribute to substance use. Mainly, we have identified that poverty is one of them, drug-related and crime-related. Those are all risk factors. Even gang-ridden communities, we have family members that are substance abusers themselves. And these are all factors that kind of leads the youth to want to experiment. They are often faced with peer pressure. They themselves are dealing with stress and anxiety and can't find positive ways to cope with that stress and anxiety and kind of use the substances to comfort themselves in those times.
Megan, this is a very touching and sad reality, but it's one that we have to face, unfortunately. So how is the youth vulnerable to drug abuse, especially in this time of a pandemic?
We know that according to the UN World Report, we have kids young as 12 years old that are experimenting with drugs. And that's even decreasing. We have experienced an 8-year-old coming into our facility that was addicted to substances. They are the most vulnerable because they're at that age where they want to experience things. They want to experience a certain rush, a certain excitement. And in often poorer communities, there's not that sense of stimulation, that positive stimulation. So a quicker way out or a quicker way to experience that kind of rush is with substances. And because everybody's doing it, my friends are doing it, it made me feel powerful. It made me able to study or sleep if I was stressing for exams. So youth is extremely vulnerable to substances, especially within the Western Cape and South Africa.
Now, I can only then imagine the ripple effect this has on their education. So, Megan, how do we see drug abuse affect one's education, especially at those young ages?
Felisa, we identified that learners who are using substances, especially within schools, a lot of them have a high dropout rate. They normally start within the primary school level and they don't even reach that high school level. And it affects it so much that they're often ashamed to go back to school because they've either had to repeat a grade, and that has a ripple effect on unemployment rate.
Yeah.
An even higher crime rate and a higher poverty rate.
We need to turn this around, okay? We can't keep going on like this, Megan. So what measures can teachers, parents and the community take to assist in the prevention of drug and alcohol abuse?
I think the first and most important way for families and communities to kind of take a step in tackling that substance abuse is to acknowledge that there is that problem in your community. SANCA even provides training services not only for professionals, but for any single individual, whether you are a concerned parent, a concerned teacher, a community member, a youth leader. We provide training for anyone who's interested in just educating themselves on substance use disorder and what that effect is. And with that, they can then identify an individual who is using substances and help them when necessary.
And then on that exact note, what steps can parents or teachers or anyone rather take to help someone if they do suspect this person is abusing substances? But more importantly, what if this person just doesn't want the help?
What's important is to first identify warning signs. Mainly there are these dramatic behavior changes, mood changes, lack of interest in school, if you've known your child to be a charismatic, bubbly child, and then that changes, that could necessarily sometimes indicate that your child is experiencing with substances. We even have schools that are educated in drug testing. So often educators themselves, they know or they can easily identify when someone is abusing substances and then refer to us. When someone isn't compliant, especially when they're over 18, we do advise parents or teachers to get a court committal.
Okay.
Because SANCA works on a voluntary basis, we can't necessarily force anyone to attend an outpatient treatment program. The main focus is, or the main goal is, for that person to acknowledge and not deny that they do have a problem. That's the most important thing first.
Thank you for that clarification. Very important indeed, Megan. Now, what can the youth do to create an awareness to prevent substance abuse? And what can they do should their friend or a family member be on drugs?
The first thing they should not do is judge. We know the judgment and shame is big when it comes to substance abuse and for even teenagers who are experiencing. So if you are assuming that a friend of yours is using or a fellow peer member of yours is using, first speak to them. Don't confront them. Don't go behind their back. We understand that you're trying to support them, but first come from a point of concern and not judgment. I think that's the most important, not to kind of feel that you're pushing me away, you're judging me, you're labeling me as this person, you don't know what I'm going through. So try to understand where that use was first identified as.
Thank you so much, Megan, for the incredible work that you're doing. We appreciate it. As we have moved out of Drug Prevention Awareness Week, it is important that we keep this message going throughout. Thank you so much, Megan.
Thank you, Felisa.
We encourage the youth to not succumb to peer pressure and to seek help by reaching out to a counselling facility, a teacher or a parent should they feel that they're not coping or they have to resort to substance abuse. Do not be afraid to seek help.